Before we get into the news, don't forget to like this video, subscribe, and hit the notification bell to stay up to date with our videos. Thank you. As COVID-19 vaccines roll out, who will get them first? A panel of scientific advisors at the CDC met yesterday and issued its recommendations on who should receive the first COVID-19 vaccinations. The guidelines are not binding on states, but hopefully the recommendations will have some influence on those policies. The Centers for Disease Control and Prevention's Advisory Committee on Immunization Practices supported the recommendations in a 13-1 vote. We will not know who in Inyo and Mono counties will receive the vaccines first, but it's a safe bet that California and its 58 counties will closely follow the CDC guidelines. Typical of the response to the national crisis so far, there is no national policy or attempt at coordination between the states in handling the spread of the coronavirus across the U.S. The problem? Mostly politics, of course. A medical disaster turned into a political football. The blame, of course, should not fall fully on politicians. Many Americans have ignored the advice of health authorities and continued to travel widely, meet in large groups and family gatherings, and not follow basic precautions on social distancing, hand washing, and wearing face coverings, either from indifference, COVID-19 fatigue, deliberate ignorance, often based on their political beliefs or personal self-interest. One big concern now is that many diagnosed as positive for the virus and those who contact tracing has identified as being exposed irresponsibly ignore the rules they are asked and agreed to follow by the health authorities. Despite that doing so risks the health and even lives of others. Up to 40 million initial doses of vaccines from Pfizer and Moderna, provided they get final approval, will become available for the end of December, followed by a second dose in January and February. Because of their importance in saving lives, workers on the front line, the estimated 21 million healthcare workers, along with 3 million residents in nursing homes, the most susceptible to the virus, will all be first in line. Next, there are those over 65 years of age, followed by essential workers, and finally, the rest of the public in staged phases. The initial vaccination is followed a month later with a second dose. Finally, there's some light at the end of the tunnel after months of hospitalizations, deaths, and severely negative economic disruptions in many communities from COVID-19. There are still up to 6 months before the vaccines will have become available to everyone. It will take time to get things back to something even close to normal. And what will that normal look like? Thank you for watching our video. Please don't forget to like and subscribe, and make sure to hit that notification bell so you know when we post a new story. Thank you. Have a great day.